what do you expect in terms of how much time he'll be there?
Well, he's going to have surgery today, this afternoon.
What type of surgery?
He's going to fix the fracture over his eye. We call it the anterior table of his frontal sinus, so it's over his eye, right around his eyebrow. Put a plate, maybe a little bone graft to stabilize that. Right now he's awake, he's alert, knows what's going on. The idea is to get that fixed. Hopefully within a couple of weeks he can start exercising, start throwing, and hopefully be back, within 6 to 8 weeks to be able to contact. The problem is you don't want him to get back to contact or pitching too soon because it doesn't, just in case another accident or some type of collision happens or a baseball hits him again. So he has a very mild concussion, no other brain injury, eyes fine. Right now he's a very lucky guy. When you see those type of things, I've seen, we've all probably witnessed some disasters. He was well taken care of here in Arizona, very well taken care of, as a matter of fact, and he's at the right place, right hospital. He's got some good doctors taking care of him, and I want to thank all of them.
You were around when Sean Casey had the same thing. How does that compare to that?
It's similar, different bones, similar than what Sean had. Sean had some other problems with his eye that had to be addressed. Aroldis does not seem to have that, which is terrific. That's one of the things you look at. You also look at any type of a brain problem, which he does not have. So he's very, very lucky to hit him in the right spot. Obviously, what is the right spot? The right spot is nothing major, nothing vital getting injured. So hopefully get this done today and get him on the road to recovery. But he appreciates all the support. His teammates were there last night with him. It was very, very touching, and it was really neat to see the coaches and the players show up in the middle of the night to see him.
Will he be transferred back to Cincinnati for more medical attention?
Just afterwards. He's in the right spot right now. We've explored all the options here as far as what to do and what the best care, personally the best care would be. And right now the best care is to take care of him here, get him stabilized. He'd really be very difficult to fly. Driving back's not an option. And there are terrific physicians here in the Phoenix area. We've been able to seek them out, and they've been very cooperative and wanting and able to help us.
Any idea how long he'll be in the hospital?
Probably a couple days. Surgery today. Probably go out of the hospital maybe Saturday. Depends on how he feels. He's got a nice local support staff here, too, with some of his family and certainly his teammates in the Reds organization. So, we'll see when he's comfortable, but a couple days.
Do you know his performance? Or?
I'd rather not say right now. It's kind of a myriad of things, but be able to talk about that later.
Is it several fractures that he has, or is it on like the brow bone?
Well, when you have a fracture, sometimes it doesn't fracture just in two. Sometimes they fracture in pieces. That's just the way those bones are. They're very brittle. But the fixation is the same.
Is it like a shatter? Or is it
I wouldn't say shattered. That's the wrong way to say it. But it's just, it breaks in multiple pieces. But that's, when you fix them the same if it was like broken in two. The idea is to stabilize it so he can get about and do the things that he wants to do, walking around, working, exercising, and just get his normal self.
The Kremchek plate will be permanent
Yes.
the rest of his life?
Yes. And that's what they typically are. Occasionally they take them out if they cause them some pain, but not in this area. I think it'll be permanent.
Do you think it's reasonable?
Titanium, some type of metal alloy. Something very malleable, obviously, and small and thin.
Doctor, do you think it's reasonable to expect him to pitch this year?
Oh, absolutely. Absolutely.
Is there anything safety-wise that can be done for these kind of injuries? We've seen several of them. They've approved a cap that nobody seems to want to wear. Or is it just something that happens in the 150-year history of the game?
Well, this all started with aluminum bats in Little League, and all of a sudden we went up to the base coaches. Now they're talking about pitchers wearing vests in case you get hit in the chest, obviously in the face, helmets on the mound. These are things that have to be looked at. These balls come back awfully fast. He throws it hard and it came back even harder. The safety of our players is extremely important, so I'm sure that this is something that's going to be looked at again. It's the national news, and these are things that gets things stirred up. So, whatever we can do as far as safety, how you look on a mound is probably secondary to safety. We don't want to ever see this happen again to anybody.
The problem, of course, if you get hit in the face, there's not a whole lot to do to protect the face part.
Well, again, they've bantered around face masks and helmets and every other thing. Some of them are realistic, some of them aren't. Certainly safety is an important aspect. This happened last year to one of the pitchers for the Pittsburgh Pirates. Similar, a little bit different. He missed some time, but again, the line dries back at this level pretty fast, pretty scary.
Is that the part of the head that's probably most protected? Because I know McCarthy got hit in the side of the head.
Well, if you get hit in the side of the head, that could be disastrous. Again, where he got hit, or Aroldis got hit, again, you don't want to say he got hit in a good place because he's undergoing surgery, but it could have been a lot worse, a lot more injuries, a lot more permanent. He's very lucky, and he'll be able to be a normal human being and a normal athlete and play at a high level.